Thank you, sir.
Next author is Chandrakanth. Chandrakanth is here.
My paper for the day is Lasik trans-PRK laser that is using a microkeratome, and the other one is a trans-PRK. Aim is to compare the visual acuity and complications in 20 eyes which are undergoing Lasik laser with a microkeratome blade versus Lasik trans-epithelial photorefractive keratotome. Materials methods, it's a prospective study in a tertiary eye care center in South India. 1 year follow-up, 40 myopic eyes, 20 in each group. 20 eyes underwent Lasik Excimer laser with microkeratome blade assisted with the flap. 20 eyes underwent transepithelial photorefractive keratectomy. This is the demographic pattern here. You can see this gender-wise both male and female are in equal numbers almost. This is the graph just shown. A detailed dynamic and static refraction was performed. Slit lamp biomicroscopy to assess the corneal status, opacity within the cornea, endothelial status, stromal status, and lens status. Fundus examination after full dilatation to rule out any significant lattices and retinal holes. 8 eyes had retinal holes which were barrage lasered. Laser procedure, Lasik laser procedure was done 1 month after the barraging laser. The procedure steps, detailed tests were done: lacrimal duct syringing, corneal sensation, intraocular pressure recorded application, Schimmer's test, corneal topography using topalizer and oculizer. Inclusion criteria included the thickness of the cornea was between 495 to 600 microns, corneal curvature between 41 to 47 diopters, up to 12 microns anteriorly and up to 18 microns posteriorly. Corneal elevation. Ablation depth were calculated, it was between 45 to 60 microns in TRPK and 90 to 140 microns in Lasik group. This is a procedure, Lasik procedure with a microkeratome blade. Pre-placed markings to see that the flap is placed in correct position after the procedure. Microkeratome blade. The flap is created, flap is lifted off, kept a plaque at the hinge, it is protected, Excimer laser is applied, thorough wash is given to remove the tissue debris, the flap is replaced. Then coming to trans-PRK procedure. Here the Excimer is applied directly. The trans-PRK procedure. The technology is called streamlight technology. A single procedure, both the flap and the laser is done in a single procedure. Here we have to apply mitomycin. The results here. The pre-Lasik group visual acuity refractive power and procedure visual acuity is depicted in the master flow chart next. In the microkeratome blade assisted Lasik group, 15 eyes had an uncorrected visual vision of 6/6. In the trans-PRK group, 7 eyes had 6/6 within a week. This is a flow chart. After 1 month, 19 eyes had an uncorrected vision of 6/6 in the microkeratome assisted group, and in the trans-PRK group, it was 13 eyes which had an uncorrected visual acuity. At the end of 1 year, 17 eyes had a vision of 6/6 uncorrected in the microkeratome group, and 19 eyes had 6/6 in the trans-PRK group. Post-procedure, we know that the pain, halo, and contrast sensitive are issues. In this 50% patient in the trans-PRK group had pain, mild to moderate pain in first 3 days. None in the microkeratome assisted group had any pain. The epithelial cells may not regenerate smoothly uniformly on the stromal bed, which induces pain and discomfort in the PRK cases. The smoother epithelial sheet created using a microkeratome allows quicker, smoother, and more adherent attachment to the desmosomes. There was no color contrast tolerance in either group. Previous studies reported decrease in contrast sensitivity post-Lasik due to the change in the shape of the cornea and increase in higher order aberrations. But here, the contrast sensitivity remained constant throughout the procedure, as the newer lasers had a wider ablation diameter than previously used ones. Halos during driving were similar in both groups. It lasted for less time in trans-PRK group, but persisted for 3 months in the keratome-assisted group. This may be due to difference in the pattern of wound healing in both the procedures. Discussion trans-PRK group keratomy and microkeratome blade assist Lasik are two distinct varieties of coronary refractive procedures. In these 20 eyes, each group had a visual recovery was rapid and the microgroup based Lasik, but the visual recovery was sustained for a longer period as seen in table 3. At the end of 1 month, 19 eyes in the microgroup had 6x6, 13 eyes in the trans-PRK group. At the end of 1 year, 17 eyes in the microgroup bleed assisted Lasik had 6x6 uncorrected. Trans-PRK group, it was 19 eyes uncorrected. Pain was significant in the first 3 days after trans-PRK group in this study. Lasik laser, be it transepithelial or microkeratome based refractive procedure, here to stay. Depending on the need and demand of the patient, the ophthalmologist should provide proper advice and accordingly manage. These are my references. Thank you.
How did you choose which procedure to do on which patient?
That's left to the patient actually. After counseling, when you tell about some patients, when you tell that the blade microkeratome, they'll get scared or sometimes. So it's left to the patient. Whatever the patient wants, we do that.
Okay, thank you.
Welcome.